Good morning. This is Dr. Bill White again, and I want to talk to you about one of my favorite subjects here. Is the etiology of malocclusion, and I really prefer the word cause of malocclusion, but if in all the writings and everything they refer to it as etiology. But anyway, I think of any problem you run on in orthodontics or a lot of life, really. If you want to get rid of the problem, find what caused it and get rid of the cause to start with, and then your treatment is much simpler. If you do not figure out the cause and you do not get it, then you've got a difficult job in doing the case, and you've got a more difficult job in retaining it if the cause is still there. Usually you get tired of trying to retain it, and the thing comes back and you get a relapse on it. So work at the cause of it to start with. Now I want to refer to this video is going to be a lot of just talking to you, but I'm going to show one case that did not get treated early and what happened to this particular case. Now I have to tell you a story. I worked in Africa when I was my wife and I had 3 kids there, and worked in a dental clinic in Ibadan, Nigeria. And I went out. We had schools out away from there in smaller towns, but there were a lot of kids in this school, and I carried the young men that I used in the office. They allowed me to train them to clean teeth. There just weren't hardly any dentists in Nigeria at the time. And so we went to this school, and I did all the fillings, and then I did all the orthodontics, if you can believe it. Well, I filled only 12 cavities in that whole school, and nobody had ever been to a dentist. And I did the orthodontics. I took out one supernumerary tooth on one young man, and it allowed the teeth to straighten up, but the rest of them had virtually straight teeth. I mean, they were bimaxillary protrusive, but they had straight teeth. I didn't have to do anything. I mean, and I got away. I didn't have a camera, to take pictures of this school or all these kids, but there were a lot of them, and I had no malocclusion in that whole school. And I wondered why on earth, or how on earth did this happen? In America, there would be half of them would need some kind of orthodontic work to straighten their teeth out, and you'd have very few of them that would have just ideal teeth. But anyway, I went ahead and did that work, but I did not get pictures of it. So you just have to take my word for it. This was in 1962, something like that. It was a long time ago. I did run into one of these young men later on in life. He was a pharmacist and was married to a lady from Nigeria who was taking a course, and I got to talking to him and found out that he had gone to this school. So I'm pretty sure that, in fact, I worked on him when he was a kid too. And he had, of course, beautiful straight teeth. So why did these children come up with no orthodontic problems? Well, I looked at the way the Nigerian people do. I mean, they carry out in the little villages and everything, they carry the child on their back virtually all the time, and they never have any relation with their husbands or anything for about 2.5 years, and the child nurses for 2.5 to 3 years. If they don't nurse back in these villages in that time, they did not get any protein properly, and so they died of what they call kwashiorkor, or that's the young, if the mother has a baby again after the first child is about a year old, something like that, then the first child dies normally. And I've been way out in the bush and took a picture of one. I don't have it here today, but it's he was so embarrassed, this young man, and his stomach was as big as a watermelon, and I felt real sorry for him. And anyway, this happens, and so the mother doesn't have any relationship with the father at all until about 2-something years, and so that the child nurses for 2.5 to 3 years, and they spend a lot of time nursing. Now, I feel like the lack of nursing today causes mouth breathing. Now, while a child is nursing, they have to breathe through their nose. There's no way that you can nurse and breathe through your mouth at the same time. And so the tongue and the sucking mechanism in here develops the airway, and so a child will develop a good solid airway, and they also get these enzymes from the mother, what they call the antibodies, and that they pick those up from the mother, and that helps their resistance to bacteria and also to all allergies and stuff in that nature. Now, and developing the airway young like this is an important thing. Whereas if we take our kids, and a lot of times you give them a bottle or they just take it real quick or something, it's hard to reproduce the benefits that an infant gets from nursing and being with its mother for many hours during the day. I mean, they will nurse even when there's very little milk that they're getting. They still nurse, and they breathe through their nose, and they develop the airway up here, and it's much better. So this is my explanation for that. Now, if you breathe through your mouth, your tongue almost has to be in the bottom of your on your bottom jaw. And I'm a mouth breather, and I'm not a bad one, but my lower teeth expanded out, and my teeth, actually the upper teeth are not wide enough to come out and fit over the lower teeth properly, and this causes you to bite your cheeks. You can bite your cheeks a lot. I'm going to kind of go on and see what we had. Now, I'm going to show you a young lady that worked in my office, And when she brought her jaw forward and everything, she looked pretty good. She's got an excess vertical height of the face in here. And I want to first, though, show you something. I'm going to erase that. Now, in my own case, you have your upper molars should come out over your lower teeth, something like this, and your cheek is in here when you're chewing, and so you don't bite your cheek. But my lower teeth are wider than they should be, and they meet. This is not a good molar tooth. They meet something like this, and my teeth are ground off, and the lower teeth are shoved out here further, and when they meet like this, and your cheek will get in between your molar teeth back here in your bicuspids, and you tend to bite your cheek. And this is a problem with people that have been mouth breathers or something of that nature. And you watch the lower jaw expands out and it gets wider, and people tend to bite on their cusp, and then a lot of people will shift their jaw to one side so that they can chew better. And if they do this when they're young and it stays there for quite a while, then the TMJ problem up here develops. It changes the whole condyle fossa mechanism, actually changes. It shifts over. And you look at people's faces on the news, anybody with good teeth, and many of them have their chin will be off to one side or the other side. Now sometimes the jaw widens out quite fast, and you will have the lower jaw just be outside of the upper jaw. In other words, you have your upper molars here, and the lower molars will be like this, and that'll be maybe on both sides of the mouth. Have cases like that, and that's caused from mouth breathing, and the tongue is fitting down here. And if you think the tongue won't spread your excuse me, if you think the tongue won't spread your mouth out, you're mistaken. The tongue has a tremendous effect in here. I have a case that had cancer of the tongue, and they took the tongue out, and the teeth just tended to go in like this, with no pressure there, but yet they had pressure from the cheeks. So the tongue expands the lower jaw. And I've had very intelligent people. I mean, a guy that wrote lots of articles on orthodontics and everything else was wondering why we had so many cross bites and stuff, and how we had so many, double cross bites, out here. And it's nothing but breathing through the mouth. If you breathe through your mouth, your tongue's in the bottom arch, and it doesn't go up and expand the upper arch here. And so the upper arch underdevelops, and that underdevelops the airway, so they don't have the adequate airway either. And then this makes it even worse, and so they can't breathe good because the airway hasn't developed properly, so the tongue stays down here more, and the lower teeth widen out, and it may do it on one side only, but frequently. Now here in this particular lady, she shifted in this direction. She's got a crossbite over here, and the midline shifted. Over here, it's beautiful class. It's class 1, but it's kind of sunk in on the side over on here. And over on this side, it's class 2. Now, she developed a TMJ problem, probably related to shifting the jaw from one side to the other. And so here let me get to that. Makes it kind of complicated and more than just the development of malocclusion, or the cause of malocclusion, but it's all goes back to not being able to breathe properly, and the breathing depends a lot on how the airway develops while you're a infant. So and when you see something like this developing, go after it. You see, immediately. Don't sit around and wait till they're 13 or 14 years old to work on them. Go after them and put something in there, expand the palate and get it back out there and bring the roots of the teeth. You don't just push and I see these palatal separators just have bars in here, and that just makes me hurt. I mean, when you go out like that, the crown moves out and the roots actually go in some when the crown goes out. The crowns are in the air and they go out real easy, and the root back here will tend to go lingually, and that reduces the airway even sometimes even more. So this is my thinking and my feeling that this is one of the main problems of developing malocclusion, is the lack of developing the airway to start with and keeping the tongue up above, and the tongue widens this out. Now I think this lady may have had some a little bit of a tongue thrust. It doesn't show that on the teeth here, but she shifted the jaw and it's over here. This is perfectly fine, and this one on this side is class 2. You see, so it went back over here. Now to correct it, we had to make this a class, we had to hold this one back with class 3 elastics and develop the one on the other side. So you ended up with a class 1 over here and a class 3 over here, which was a class 1 to start with and a class 2 to start with. You have a TMJ problem, so it reverses the thing. That gets a little bit too complicated, I think, for just what I'm trying to show here is the etiology, or the cause of many malocclusions. And this is so common in American people, and I don't guess many people of the world now that are, and it would be wonderful if we could develop something would give a child the same benefits they get from the mother nursing the child and holding them up close. It's a psychological thing too. I feel like that. And the child might nurse for a long time, and maybe it's getting very little milk, but just a little bit, and they love that, and I feel like that is one of the big reasons for the malocclusion. Now on this lady, I'm going to run through and show what we did. You see the crossbite over on this side, you see. So the tongue has spread this out, and she shifted to the left, to do this. And by the way, you breathe through your mouth, and you don't swallow properly, and you don't bite your teeth together, and so this stays open too much, and these teeth erupt down toward one another. The uppers come down, the lowers go up, and whatever they move together, it increases the vertical dimension of that person's face, and that messes up the looks. Now you see the upper arch is not developed out. It should be way on out here, you see, and around it. So go after it and put something in there that's rigid and holds those teeth and expands it and brings the roots out as well as the crown. Don't put some, that is a ridiculous thing, to put a bar in here, shove it out. The crowns just go like this. Now when they go that way, the roots go in. And when the roots go in, that even reduces the airway. So we need to keep the roots going out with the crowns when you fix this. Now we went in and here we're very crowded, and they didn't think, you could widen this. We widened this out, and I've watched this lady for 20 or more years, maybe close to 30 years since she worked in the office, and she even went to Georgia. She learned orthodontics and worked for some pediatric lady in Atlanta, and I'm sure did a good job for her. And this is where this goes. We pulled this one back and brought this over, you see, to line this up. And that was in 1988. And let me erase that. Now, when we started out, this was a nice Class 1 relationship, even though she had shifted her jaw. This was out much, so she shifted, and the crossbite ended up on the other side. So they have a unilateral crossbite, or they can develop a bilateral crossbite in doing this. Now the TMJ was bothering her, and I had to advance her mandible. So now we've got a Class 3 problem and a Class 1 on the other side. We've advanced the Class 2 to Class 1. That's kind of tricky. Unless you've done that, you might not think of that. Now this one, we had to move it this like that to bring this up to a Class 1 relationship in here. So much of the problem here, and I think virtually all of it, was related to breathing. Now she's 32 years old, and people thought you could not separate somebody, but we started years ago putting spring between these teeth up here on people, on older people, and we could separate people all the way in their 30s, and sometimes I can separate somebody in their 40s, and I can take somebody that won't separate, and we can still spread their arches out. So you can move them and expand them as long as you're living. So don't let anybody tell you you're too old to expand your maxilla. Okay, here is the lower arch. You see is much wider and developed in here. Now we used a kind of a super duper deal. I've got a video on that. You can look it up. So I'm gonna show you the face, and I'm gonna stop. Now this is too much vertical height to the face in there. And then their jaws back, so we advanced it out here, and it just looks so much better. And that's the way it was. This is the models, and here's the way we ended up with it. We expanded this, and this frayed is a little shy of tissue here, so she had a graft after she went to Atlanta, put in the bottom arch. And I've followed this lady for years, and she over brushes up here, having that, but you can have those filled. I've had mine filled over a period of time, and it was Class 2 like that. Now we open the bite, but she relapsed. We treated her in 11 months, and that was too short a time. they were working in the office and they wanted to get out of these things. And so really I was intending to keep it longer than that, and she needs to have them scaled and cleaned. There's the way the side was, and there we went to that. And over a period of time, you expand the mouth and get them breathing properly, biting properly, and I do actually feel like we reduced the vertical height of the face some. This is later on, several years later, and she's still in there with the midlines off some. And here's pictures of her face. It looked much better. It looked like we've got a pretty good vertical height of the face in here compared with what it was when we started. It's not that different cephalometrically, but it certainly looks better. Now if you look at this, this looks just almost normal in here. So for about 20 years or more, she's been breathing through her nose, and she bites her teeth together when she swallows, and that over a period of time I feel like lowers the vertical dimension of the face. In other words, in her case, it made her look a lot better. And this is her smile. So anyway, I hope you get something from this. The cause of malocclusion is mouth breathing, and it starts at infancy on. And so I don't know how you're going to get around that, because American mothers just can't. I mean, there are so many of them at work and stuff of this nature. They have to give the child a bottle, but the child nursing a bottle is not like being held up close. The psychological effect and the actual physical effect on the child's facial structure and his antibodies and how he resists disease and stuff from the mother's passing on this protection to the child. So maybe you get something out of this, but there's the way it looked, and we advanced the mandible, and let me go back, and we ended up with it like that. So thank you for watching, and I'd like for you to join our group and subscribe to our program, and we'll try to do this, but I'm getting old too. So anyway, good luck, and appreciate you watching this. So I'm gonna close this out now, if I can get over here and stop it.